Let's compare a naturopathic doctor with an allopathic doctor. How would the allopathic doctor conceptualize disease?
Oh, so I think most allopathic doctors are looking for potentially a cause, and if it is, it's usually something you can isolate, like a germ. And most naturopathic doctors are going to be looking at the terrain, and they're going to go, okay, well, why is the body getting, and they're going to kind of wonder what's the root cause. And there may not even just be one. There might be a few things going on that created, whatever picture of health we have. So a lot of times when I'm looking at labs, they're like, whoa, my blood sugar's off, my cholesterol's all over the place, my blood pressure's not manageable or stable. I can't, and it sounds like they have 1,000 things wrong with them. And it's not that you have 1,000 different diseases, which you might get diagnosed with if you were in the medical model. But in reality, most of the time it's one problem. There's like one disease, there's one issue. It's probably inflammation. What caused it? We got to find that part. But I think that's a huge, huge difference. The other thing I would say is there's a huge emphasis in Western medicine to suppress symptoms, which is valuable, especially with pain. But naturopathic doctors were not entirely interested in just that, because for us, those are clues. For us, it's considered, a good thing. Like, oh, good, you've got a symptom. That's helpful information, because some people will, like, for example, my ex-sister-in-law, she said, I had 0 symptoms or knew anything was wrong besides infertility. She had 3 miscarriages. And she said, that's the only clue I had that something was going on in my body. And it turned out that she had celiac disease. So for her, she gave up gluten, and then boom, body was better. But she thought, I don't need to eat this again, because even though I'm not getting symptoms, my body still doesn't want it, even though it's quiet to let me know it doesn't have it. You know what I'm saying? So we do look at that part a little differently as well, which I think is essential. And it's a longer thing. If you're going to see an ND, prepare to put in a lot more work and take a lot more time to turn things around, because we don't have magic pills. And people always ask me, they say, like, what supplement's good for blank? Nothing. They're not pills. It's not Western medicine. I can't give you anything that's going to magically change anything. So it's going to be a lot more of a process and more teamwork as well. I do like that. Like, usually the doctor's the one up, the patient's the one down. In Western medicine, at least. But with naturopathic, we try to have it be more like team care, because there's this idea of like, okay, well, now we've created this organism, like you and I, like we heal together now. And so we have to work together to see about getting you feeling better, because then I learn at the same time. So it's a growth for both of us.
Okay, so you have a personal story. And so you took your path down to specialize in mental health. So, how did you go down the direction to become a naturopath? How did your own experience in the medical system kind of inform this new direction for you?
I had very severe OCD symptoms for a long time. And I don't even really like to say OCD, because I don't actually believe it's a disorder. I think they're symptoms, usually based on physiology, but I'll get to that. And so for me, I had a lot of obsessive compulsive symptoms. And so when I went to Western doctors, it was always, oh, you could try Zoloft, you could try, medication. And I was horrified, because I read that they could, cause some weight gain and sexual dysfunction. And I thought, well, if I'm already depressed, do I really want to add those to the mix? That might make me more depressed. That just seemed a little scary. So I didn't really want to do therapy either, because everything I was thinking was incredibly embarrassing. And I thought, I don't want to tell anybody, like, the thoughts up here. Like, and I was thinking about, I was a nanny, and I was like, I just kept thinking about obsessing about throwing the kids out the window. And I would never do that. But
Right.
I mean, it's scary to tell that to somebody. You think they're going to lock me up if they know what I'm thinking, you know?
Hmm.
So it seemed like my 2 options were pretty terrible, at least to me. And I'll be fair. I think I was a little resistant to feeling better, because I knew it would be scary. So eventually did do therapy, which helped a lot, but it was really revolutionary when I saw a holistic doctor, because she said, no, this is more physiological. This is more hormone for you. There's a parasite. There's a bunch of stuff going on. So let's work on that. And then we'll just see if you still have some symptoms. Let's see if we've gotten it. And then I think I must have left with like $500 worth of supplements that day. And I thought, oh my gosh, is this what I'm doing? So I took all these supplements, and I stopped eating the food she told me to stop eating. And within a month, my OCD, and it was, 9 or 10 showers a day. My knuckles would be bloody from hand washing. I just like walk in circles up staircases. My life was jam packed with rituals. And then all of a sudden, 90% of it was gone. I had all the time in the world. And it was the most amazing and startling thing because I thought, well, now what I'm going to do with who I am, what's going on? It was kind of a identity crisis. It was a transformation. It was amazing. And because of that, I said, what do I do? How do I do this? And she says, you should go to naturopathic school. And I said, that's what I'm going to do. Because I felt like if I was so severe, and I was told that, I was told, you're too severe, you have to do meds. But I thought if I was so severe and I got better, then it felt like it was my responsibility to show people that there's a way to do this that didn't involve some lame genetic theory about, oh, there's probably some mysterious cert gene that's involved in your serotonin regulation, and that's why you have OCD. Have a medication. To me, that's garbage. It is. It's total garbage. So if we could help people just do something different without these symptoms, then it just seemed like there was nothing else I wanted to do.
So then what was the underlying mechanism that led to your OCD? Like what did the supplements or the changes in diet actually correct that was problematic or deficient previously?
Good question. I had, at the time, very low progesterone, and it was probably exacerbated because I had some disordered eating stuff going on. I really wasn't getting enough calories. So that, no calories, no cholesterol, no pregnenolone, no progesterone. That probably had a trauma history, I'm sure, looking back. The other thing I would say is that some people just genetically just don't make quite enough GABA, and I probably am one of those people. Mine always tends to be on the lower side. And so for me, going in, she's like, oh, okay, progesterone, we can do that part. Started taking different supplements to help support my GABA system. And because I wasn't eating enough, your digestion turns off. You don't use it, you lose it. So my digestion was really bad and my absorption was poor because I really wasn't eating very much. And the intestines being like little muscles pushing foods through, if we don't eat enough, then your intestines get weak and then you get more gas and bloating and food kind of gets more rancid sitting there too long. So once we improved my digestion, then all of a sudden it seemed like my brain kind of turned on a little bit more. And if you're too hungry, you won't sleep. So then my sleep got better because my digestion got better. And then I started sleeping, started healing. So for me, I was always probably a little bit low in certain areas. And then I think there's usually a trauma component when it comes to mental health at some point in there, kind of mixing it up. And I've been reading Matthew Perry's book, and it's amazing. Have you read that?
No.
Oh my gosh. Okay, so I won't spoil it, but he talks about getting phenobarbital as an infant for 60 days because he had colic. And so for those that don't know, phenobarbital is extremely potent barbiturate. It's meant for seizure. It'll knock you out. It'll just knock you out. So I thought, of course, Matthew Perry has had a lifetime of addiction because he was probably chronically deficient in opiates because he was set up for it. If you're taking that much of a medication so early on, like the body's going to think, oh, that's my new normal. So I do think the formative years matter a lot in terms of what happens to our brain and what we're teaching our brain that we need or don't need. And that could be anything, like whether it's barbiturate, trauma, or whatever health issues going on, and that isn't to say it's like a destiny, but it is to say it's an area we kind of look for. So for me, when I'm stressed out, I kind of have to encourage my GABA system to, give it a little more support because that's where I go with my stress.
Yeah, so I do want to follow up on that because I specialize in the treatment of eating disorders and I've worked with anorexia for decades now. And as you probably well know, there is a strong comorbidity with obsessive compulsive symptoms. It's almost always around food, but it also extends to a lot of other areas that you were referring to. So, like, how do you distinguish between like how you treated yourself and viewed yourself outside the lens of being like nutritionally deprived and a starving brain that then would become very obsessive, probably as some evolutionary adaptation that, we would experience probably historically in response to famine and a number of other things. It makes sense to be very obsessive and compulsive to stay alive, and to also like prevent yourself from overeating food when it becomes available to be able to, share with the group. There's some really interesting evolutionary kind of thinking around the development of eating disorders. Am I hearing you correctly that like once you started to kind of heal your body from starvation, that the OCD symptoms started to decrease, or are you looking at it differently?
No, I am looking at it like that. I think
Okay.
most
Mm.
disease does stem from that inflammation. So absolutely. If and most people tell you like if they're anxious, a lot of them aren't eating enough.
Actually, this I'm glad you started talking, Roger, because I was more interested in maybe how a traditional cognitive behavioral therapist who is meeting with somebody for OCD may approach the situation. We've discussed how the physical and mental health are so connected. This is an example of that reality. How would you approach it, or how do other clinicians approach it?
So I'm a little bit different because I kind of exposed myself to the world that Julia is involved in. And
Hmm.
I have a background in the treatment of eating disorders and highly focused on nutrition and food and know what the symptoms are for people who are nutritionally deprived or, just have a starved brain. What I think happens in the general mental health world is they view psychiatric conditions as diseases. So they treat OCD with exposure and response prevention, right? Maybe not even aware of all the other medical issues that could influence that
Hmm.
symptomatology. I mean, we even like forms of like strep, for example, like strep throat, certain bacteria can also create OCD symptoms. And we had Dr. Kristen Ryman on here, and
Yes.
there's like a lot of conditions, probably parasites as she mentioned, and in our area, Lyme's disease,
Hmm.
create these psychiatric symptoms. And that's one of my biggest concerns with the psychiatric industrial complex is the idea is that anything that they don't understand, they just look at as a series as symptoms, and then without investigation, they just label it as psychiatric and then treat it as psychiatric. So,
Hmm.
what would be the standard course of treatment for someone who is experiencing OCD? It would be like Zoloft and exposure and response prevention.
But what about a psychologist who's not prescribing?
Well, psychologists still would, potentially refer
Okay.
for that SSRI if they're following guidelines like they're supposed to.
Mm.
And then it would be exposure and response prevention, right? Which is a pretty effective treatment in the manner in which psychological treatments are deemed effective. Although, like maybe half of the people still won't get better,
Mhm.
but half of people making improvements in those areas is pretty successful in the field of psychiatry and psychology. And they're probably a component to that, right? Like our brains can get hijacked by fear for many different reasons, and Julie's kind of referring to our own learning history, maybe our own genetics. um, if we believe in epigenetics, which I'm sure we'll get into, that there's probably some evolutionary function to having OCD, right? And when that gets provoked in a certain environmental context, that gene probably gets expressed in some way. And then there's a learning, like you behave in this certain way as a way of kind of suppressing fear or feeling in control. So I think there's multiple components to it. But I do think that the foundational treatment, which Julie was referring to, is you have to do investigation
Mhm.
and make sure that medically speaking, that there's not other issues that can be more adequately targeted with lifestyle, nutrition, or the identification of bacteria or other things. So, Julie, are there other medical conditions that arise that would lead someone to have obsessive compulsive symptoms?
I think I haven't seen maybe two cases alike, to be honest, in terms of causation. I've had people with thyroid issues. As soon as we correct it, something so simple, as soon as we just a little correction, T3, OCD went away. And I've seen a lot of hormonal shifts during pregnancy results in obsessive compulsive symptoms. Parasites are a big one. It's common with Lyme. It's common with a lot of bacteria, a lot of viruses, especially the ones that get in the nervous system that can cause that. I think also food sensitivities I've seen cause that. I think really anything that's going to cause inflammation, if someone, this is just my theory, but if someone has a background where there was some kind of trauma that demanded perfectionism, then you mix that along with whatever is going on, and the body will express that inflammation in terms of trying to get control again. Because if the body can't get control physiologically, it's going to try to do it mentally. And that's really what anxiety is like, how do I get control? How do I get control? So I get at that question a lot. And I think just the short is it could really be anything. And that's why you do kind of have to do a workup of what's going on. I've even seen vitamin E deficiency cause it, which I never thought would. But we ran some tests and it was vitamin E deficiency. So I said, look, I don't know. My ego says that's not going to change anything, but let's do it because it's not about me. So we tried really high doses of vitamin E and OCD went away. So we can't,
Fascinating.
that's why I don't like the whole low dopamine means this and serotonin means that. I've had people with OCD that you think would do better with serotonin support, did terrible and did better with high dopamine support. So I don't think the rules are that hard with it.